So this is a quick look at stress and how stress relates to disease. So what is stress? Stress is um, a demand exceeds a person's ability to cope. Uh, so you have various reactions. You have disturbances of cognition, recognizing things, emotion, behavior, uh, and that kind of thing. That's mostly psychological stress. But there are physical stressors too. Now, the seminal work done in stress was done by Dr. Selye, and he kind of stumbled upon it because he was looking at endocrine uh, reactions to things, and he was looking specifically for sex hormones. But nevertheless, what he saw was that different agents that he injected all had the same effect on rats, and that is involvement of the adrenal cortex, and if you do it long enough, enlargement of it, suppression of thymic activity, so the thymus, and it will eventually atrophy, and the development of bleeding ulcers in the stomach and the duodenal. So basically, stress ulcers. And he tried to figure out what this was about. And he came up with this idea called the GAS, the General Adaptation Syndrome. It's a nonspecific response. We all have it. We all actually instinctively know about it. And there's three stages to the GAS. The first stage is the alarm stage. So this is when the stressor is first introduced, and this gives an arousal of the body's defenses, and kind of gets things going. Then you have the resistance stage, sometimes called the adaptation stage, but it's the resistance stage. And this is when you are doing fight and flight. This is the classic kind of you're in it part. Then you end up with this stage of exhaustion where you get compensatory mechanisms start to break down. That you stop being able to cope because you have really basically run out of steam. You can't. You can't have resistance anymore. So in that alarm stage, what happens is things get going, and you get this hypothalamus pituitary adrenal gland axis gets going, and so it's activation of the sympathetic nervous system. The hypothalamus will release releasing hormones. The pituitary will release ACTH, adrenocorticotropic hormone, and then the adrenal gland will react to the adrenocorticotropic hormone. When the adrenal gland starts to release its hormones, that's when you enter the resistance phase. And the basic hormones that are released are the catecholamines, the epinephrine and norepinephrine, which are really involved with the sympathetic nervous system response, although it's hormonal, so it's systemic. And the other one is cortisol. And cortisol is a very important one, and we'll talk a fair amount about it. If the stress continues, then you can't adapt, and so that's really when disease starts to happen. It's when you can't maintain the homeostasis, and so things start to break down. And so disease really starts at this exhaustion stage. So what this is really saying is that a real element of pathogenesis of most diseases has to come from some sort of hitting the exhaustion stage in the general adaptation syndrome, depending on the stressor. Now, the stressor could be something like cigarette smoke, and the body reacting to it. Now that's not what we would normally consider like a stressor, but it is, because it's a physiological trigger to adaptation, to change. Now, we mostly most lay people, when they think of stress, they think of these things, they are actually thinking about the psychological mediators of those things. So this is how your brain reacts, and your emotions react to the stressors. And so there's the reactive response uh, is the psychological reaction to the stressors. So uh, this is like the panic attacks, that kind of thing. Um, Anticipatory response is anticipating a disruption in homeostasis. So this is more worry. This is anticipation. And then the conditional response is associating a stimuli with danger. So post-traumatic stress disorder falls into this category nicely, but there's lots of times that we are conditioned that, like, if a bell is rung before you get an electric shock, then pretty soon when you hear a bell ring, you will have a physiological response to that stimulus of the bell ringing. It's like Pavlovian sort of thing. So these things are sometimes called a psychological overlay. They enhance what happens in the gas. So what's a stressor? We have to define that. So a stressor is anything that demands a response in order to maintain homeostasis. So anything that causes your body to have to make a change in order to maintain its homeostasis would be considered a stressor. Some stressors are actually rather pleasant. Some of them are not. So the noxious ones are pain, cold, trauma, hunger, electric shock, various things that cause unpleasantness. But they can also be important life events, graduations, weddings, excitement. Going on a first date is really a stressor. Talking in public, that kind of thing. They can really be demanding some sort of a response, a homeostatic response. So the reason that we're talking about this in this course is because stress and disease are linked, because we just said that that the exhaustion stage of the gas really precipitates disease. Existing disease, chronic diseases, are often worsened by stress. So if people have like IBS, if they have autoimmune diseases, like rheumatoid arthritis, lupus, that kind of thing, HIV, herpes, cold sores get worse when you're stressed. Because your body is less able to cope with what's going on while you're being stressed. Some diseases are precipitated by stress, things like cardiac disease. A lot of diseases of the digestive tract can be precipitated by stress. Things like ulcers and that kind of thing. There is this whole idea of psychoneuroimmunological mediators. This is the idea that we are complex beings, that your psyche, your personality, your nervous system, and your immune system all contribute to this, and there are things that interact, and throwing any of these things off can lead to disease, and stress will throw this off. So so like the body's defense mechanisms get compromised when you're under stress, things like that. This releasing hormone, you should remember from the endocrine system in physiology, but it's a hypothalamus releasing hormone that causes the pituitary to release adrenocorticotropic hormone, and then start the adrenal cortex to release cortisol. There's a big theory right now that this, which has been ignored or largely sidelined in a lot of research, but the public generally seems to understand this, that these things are important. They're important for the mediation of disease. We all know people who seem to do very well with very bad things like cancer. I have a patient that was told that she had 6 months to live because of pancreatic cancer. But her attitude was excellent, and she was like, I'm going to make the most of the 6 months. Her daughter was pregnant with their first grandchild, and she wanted to see that grandchild born. And that was going to be about 8 months. So that her goal was that she was going to see that. And then when the baby was born, she wanted to get to know the baby, and so on and so on and so on. Well, it's been 6 years now, and that she's far exceeded. Her doctors can't believe how well she's doing. Now, she's a very sick lady, but her psychosocial positiveness has really altered the health outcome. I've known other people that got a bad diagnosis, a cancer diagnosis, and were told that they had 6 months to live, and died almost immediately. A friend of mine had a very bad diagnosis, and he was pinning his hopes on a specialist in Toronto. He had a whole bunch of tests done. The specialist came in and said, "I'm sorry, Terry, there's nothing that I can do." And then left the room. To make a long story short, the specialist left the room. Terry looked at his wife and said, "Well, I guess I'm screwed." He actually didn't say screwed. He said something that started with an F. He rolled over, went into convulsions, and was dead within 5 minutes. It was a psychosocial stressor that actually killed him. So there's all of this interconnection. Now, I'm not going to make you follow this, but basically the limbic system is your emotions, your brainstem, causes the release of norepinephrine, which is through the sympathetic nervous system. See, the sympathetic nervous system is here. That causes the adrenal medulla to release epinephrine, and all of this comes, and so you end up with these catecholamines. So this is the neural part of it, and really it's the sympathetic nervous system that does it. It's the fight and flight portion of the sympathetics. So the catecholamines, the epinephrine and norepinephrine, are released, and there are receptors on a bunch of different cells, and they react as they're going to react. Now, the adrenal cortex releases a hormone called cortisol, and cortisol is a very important hormone, and it does a bunch of things. It stimulates gluconeogenesis, so it makes you make sugar out of things that are not sugar. So that it elevates your blood glucose level so that you have more glucose for fight and flight. It has a protein anabolic effect in the liver. So you start making like clotting proteins and things like that. And your blood pressure will go up because you actually increase the amount of albumin because you start making more proteins in the liver. But you have catabolic effect in all the other proteins. So like the dermis of the skin, the adventitia of your blood vessels, and things like that, have a catabolic effect, especially on collagen fibers, because that's what you're breaking down for the gluconeogenesis. That's what you're making into sugar. It also affects fat. Some parts of your body is lipolytic, some parts is lipogenic. So you start taking fats out of some parts of your body and you start depositing it. In men, it tends to be in the belly. In women, it tends to be in the boobs and bum, and a little bit in the upper back. It has a big anti-inflammatory property. Cortisol stops inflammation. And really, when you think about it, if you're in a fight, if a bear comes into your cave, you don't want your joints to stop moving. You don't want your eyes to swell shut, things like that. So it's very powerful anti-inflammatory, and it's a systemic anti-inflammatory. And it's an immunosuppressor. Again, you don't want tissue to be killed by natural killer cells and cytotoxic T cells because it's infected, when you need every bit of tissue you got to be involved with the fight and flight. Now, it's interesting because of this anti-inflammatory property and this immunosuppressive property, cortisol, hydrocortisone, is a very popular drug. It's usually prednisone. I believe in Canada, everybody over the age of 65 has a prescription for prednisone. What it ends up doing is it elevates blood sugar in those people. It causes the breakdown of collagen fibers, especially in the dermis of the skin and in the blood vessels. It suppresses the immune system and acts as an anti-inflammatory. And it's the anti-inflammatory properties that they're using. So people that have arthritis or people that have COPD and that kind of thing take this drug to do that. But how many old people do you know that with very thin skin, that bruise easily, have high blood sugar, and get sick easily? It's probably a result of side effects of the prednisone. Other people take it as an immunosuppressor. My son has had a kidney transplant, and he takes cortisone. He takes prednisone to stop rejection. So it's an immunosuppressive drug for him. But we constantly have to be worried about his blood sugar and other things with him because of it. You'll see when you meet people that are on a lot of prednisone, they kind of get chipmunk cheeks, and that's because it's lipogenic in the face. It makes you deposit fat in the face. Because it raises blood sugar and because it does all of these things, it's linked to type 2 diabetes. It's linked to obesity. It's linked to insulin resistance, things like that. So there's a lot of research going on in this right now because there's an awful lot of people are stressed. And we have this epidemic of type 2 diabetes, and we think it's mostly lifestyle, but is it really lifestyle or is it coping style? There's a big question whether obesity leads to type 2 diabetes or type 2 diabetes leads to obesity. It's chickens and eggs here. Stress probably is an important mitigating factor in getting that whole ball rolling. One of the reasons I think that exercise helps with type 2 diabetes is because exercise tends to reduce stress and the gas, the stress response. We'll talk about T1, T helpers, and cellular immunity and humoral immunity later in the course. So we end up with these various things that are going to suppress this immune response. There are other factors, I've already mentioned them, psychological factors, neurological factors, immunological factors. They all interact, and that's like we're not simple beings, so they all end up interacting. There's other hormone alterations. So when cortisol is released, then it inhibits the release of luteinizing hormone, of estradiol, progesterone, and so it's going to screw up the female ovarian and uterine cycles. That it suppresses the gonadotropin releasing hormone, which causes FSH and LH release. So it screws up fertility and things like that, and a lot of hormonal problems. I believe that it is a big contributor to perimenopausal symptoms because of its effects on this. It worsens the perimenopausal symptoms. It is involved with endorphins and enkephalins. So really, what it does is gives you insensitivity to pain, but well-being, and so these things are suppressed, so you feel more pain, you feel less well-being. So it diminishes this. It interferes with growth hormone. And growth hormone affects protein metabolism, lipid metabolism, carbohydrate metabolism. It counters the effect of insulin. So it enhances immune function. So really, stress reduces all of this. There's a big, very promising theory and research being done into fibromyalgia as being a problem of growth hormone. And again, we'll get into that when we talk about fibromyalgia. But stress obviously plays a role in the development of that disease because of its alterations on growth hormone. It affects this prolactin. It affects oxytocin. Oxytocin is the cuddle drug. It's the drug that helps you bond with things. It reduces anxiety. It is released during orgasm. It's inhibited by stress, and so that's why stressed people start looking for more of it. It's it's one of the reasons that massage therapy works, because oxytocin is released by touch on the skin, and so in a big way, a massage will help you release oxytocin, and then oxytocin counters the effect of stress, just as stress counters the effect of oxytocin. They work opposite one another. Stress reduces testosterone, and that is libido and male secondary sex characteristics. So stressed guys aren't as masculine looking, and there's a loss of libido. there are various stressors that work for different people. A lot of it is coping. A lot of it is what you perceive as stress. You know, and it's going to vary with people. Um, so some people, that stressful thing, if there's ineffective coping, you get a stress response, you end up not coping and you end up in exhaustion, and that can lead to disease. Um, if you're effectively coping, then you return to a steady state. So it'll exacerbate illnesses. It will cause illness, that kind of thing. Um, this is an interesting thought here that it explains a little bit of the placebo effect. It explains how some people treatment will actually decrease symptoms, and in other people treatment increases symptoms. If the treatment itself is perceived as a stressor, then symptoms will get worse. People that are undergoing chemotherapy, if they expect to get sick and they think that the chemo is going to be a horrible thing, then chemo is a horrible thing. But if they expect that chemo is going to make them feel better because it's going to reduce their cancer, then they generally feel better for it. It's a very interesting thing. A lot of it happens between the ears. Now the last bit is about aging, and when we age, things change. You have changes in the limbic system. You're not as easily excited about things. You There's decreased testosterone. There's decreased thyroid hormone. Other hormones get changed. There's immunodepression, which is not quite immunosuppression, but the immune system isn't as robust as it probably once was. There's alterations in lipoproteins. This is that high density and low density lipoproteins. This is really the fats in the blood, and so there are people with these cholesterol and fat problems in the blood, and it tends to go up as you age. Hypercoagulation of the blood. The blood becomes very hypercoagulatory. It's why old people are more at risk for stroke than younger people. Free radical changes, damage of cells. The tissue just ages and it's not as good. So to sum it all up, stress is an important pathogenic event. It explains very succinctly and very well why some things to some people can lead to disease, while the same thing to other people doesn't. My uncle smoked 2 packs of unfiltered cigarettes a day and worked in an asbestos mine, and at 85 still had great lungs. He coped with it, where there's other people end up with lung cancer from secondhand smoke. It's the same stimulus. What's the difference? Probably it's stress, and the perceived stress, the psychological, the immunological, the neurological overlays to it, and the body's reaction.